As we enter the third year of the COVID-19 pandemic, many parents are still confused about how to handle a situation when their child gets sick. Is that cough a sign of COVID-19 infection, or is it a cold or another type of illness? Dr. Juan Carlos Millon from Worldwide Pediatrics, a practice affiliated with the Topline MD Alliance, joins us to answer some of the common questions parents may be having right now about their child's sickness. Hi, Dr. Millon.
Hi, Rebecca.
Thank you so much for joining us.
Thank you for having me.
So around this time of year, what are the usual illnesses that you are encountering with children?
So around the end of the year, mostly wintertime, early spring or late fall, we tend to see a lot of the upper respiratory infections or the viral upper respiratory infections, which are your common colds, things like croup, which is a very particular barking cough that kids will get that sometimes can get pretty scary at night. We do see a lot of those more commonly now because people get to gather inside a little bit more because of the weather. There's a lot more closer contact, unlike in the summer. And so we get that spread of those type of viruses.
So how can you tell the difference between, a common cold with croup?
Good question. Sometimes you can't. Upper respiratory infection just describes where the infection is located, what part of the anatomy. It's more from your head up. So you'll have more nasal congestion, maybe a little bit of a sore throat, rhinorrhea or runny nose, those type of symptoms. Then you have the lower tract respiratory infections, which are things that like bronchiolitis or pneumonias that can happen in children, or even other illnesses like asthma that can happen at that time as well.
You mentioned bronchiolitis. Tell us a little bit about that.
So bronchiolitis starts off normally as an upper respiratory infection. So it's a little cold, maybe a little bit of fever on the front end, and then it seems like it starts to settle, but then the cough continues. It becomes this really wet cough. And I describe it sometimes to parents as if your child had been smoking cigarettes for the last 50 years. It can sound that bad, but your child for the most part is gonna be okay. It occurs most commonly in kids less than 2. So that's when we tend to see bronchiolitis more commonly. There are viruses that we know cause bronchiolitis, things like RSV and influenza. So we wanna try to prevent those when we can. And again, the main thing is proper hygiene, washing your hands, keeping your distance from people who you know are sick, that type of thing. With regards to what to look for when your baby has bronchiolitis, and it's not going in the right direction, is if the baby's having trouble feeding because they're having such a hard time breathing. If the baby is coughing so much that they're throwing up and they haven't been able to keep anything down, and now they're not voiding for the last 6 to 8 hours, it's something that you should make your pediatrician aware. And so those are the things that we want to kind of be on the lookout for with regards to respiratory distress and bronchiolitis in these small babies.
And kids are kids. When they're in school, they get sick. It's very common.
Yes.
When should a parent take their child to the doctor to make sure this isn't one of those more serious illnesses?
So a lot of it depends on the age of the child. I mean, if you have a 10-year-old who's got sniffles and coughing, you may be able to handle most of that on your own. Most illnesses in older kids, I would say kids above 2 or 3, usually peak around the 3rd day. So you'll get a little bit of progression and worsening symptoms for the first 2 or 3 days. And then you see them turn around and improve, and they usually last between 5 to 7 days. The younger child, sometimes that lasts a little bit longer because they don't know how to handle their secretions in their nose, so they don't know how to blow their nose. So it depends on the parents suctioning the nose or trying to do saline washes to try to keep their noses clean so that improves. So that's kind of the difference that we see in the age groups. And so the normal progression is that. So when do you take them? If things start coming out of the norm. So now my child is having so much cough, so much difficulty breathing that they can't keep anything down, they're throwing up after they're coughing, or I can visually see that they're struggling to breathe. These are times that we need to seek medical attention quickly, hopefully seeing their pediatrician within 24 hours. And again, if the respiratory distress to the point where the child is really struggling, where you see their nose flaring or they're retracting under their ribs, then that's something that may not could wait till the morning, something that maybe needs medical attention at that moment.
And now that we've thrown COVID-19 into the mix, should parents, do you advise them to go get tested or just keep them home for those few days and see if their body,
So for the most part, in children, you're not gonna clinically differentiate what a cold is or if it's COVID-19, if that's the cause of the upper respiratory infection. So a lot depends on what is my risk or what is that child's risk of passing that infection to somebody who may be more vulnerable, a grandparent, something like that. So if that's a big fear or if they're going to school, then yes, I think it's prudent to test and know where you are. If you are positive, you're basically gonna treat that child with the same things you were doing before you even knew it was COVID. So you're treating the symptoms. But that way you're aware that, okay, maybe grandma is not a good time to visit this weekend. So that's kind of what we want to do.
And in terms of treatment for these other illnesses like bronchiolitis and other respiratory illnesses, what type of treatment should parents expect if their child does get one of them?
So for a regular upper respiratory infection, we expect for the most part is treating secretions, so saline and suctioning. In the older kids above the age of 6, there are over-the-counter medications that suppress the cough or help dry out the secretions to make them more comfortable. So we are treating the symptoms, not necessarily the virus itself. So they do not need antibiotics for the majority of these infections. The younger children who can't blow their noses, most of it is concentrated on, again, suctioning the secretions, saline, make them more comfortable. Some people have used eucalyptus oils or other types of smell to make the airways feel more comfortable with humidifiers and things like that. So those are things that we kind of tend to use. We tend to avoid medications in the younger kids because they tend not to work very well and they are more likely to have side effects from the medications.
And colds are colds, sometimes they're inevitable.
Correct.
But are there any preventable measures that parents can take during this time of year especially?
Yes, I mean, the most important thing is teaching your children proper hygiene, how to cough into their arms, not cough into the open. Make sure that you're washing your hands before you have your meals, washing your hands before and after you come home from school. Those type of things help. And nowadays, the proper use of the mask, if they're old enough to use it, that's gonna help prevent some of these infections. We have seen some reduction in influenza and other viruses since we started using these masks. So they do help prevent some of these illnesses. One of the most vulnerable populations to bronchiolitis is premature infants and the young, so kids less than 3-4 months of age. They are at higher risk of developing complications from bronchiolitis, especially if it's caused by RSV, which is respiratory syncytial virus. In the premature infants, there are vaccinations that you can provide to help prevent the baby or the premature infant from getting RSV. But there's only a high-risk group of people that we do use them because the vaccines are very expensive and they only tend to work in that particular subset. So it's not for everybody. But if you have a premature infant, this is something that you should be thinking about, or your pediatrician, you should having that discussion with your pediatrician.
And as far as RSV for the older kids, are there any of those telltale signs?
So yeah, RSV is notorious for giving a lot of congestion. So it's gonna give you a really bad cold with a lot of nasal congestion. Most of the older kids are not gonna end up in a hospital because of RSV. I mean, some older adults can. So again, it's the vulnerable populations that are at high risk, but for the most part, it's like a regular cold, just you have a lot of congestion coming with it.
We haven't seen the influenza for a couple of years in those numbers that we saw beforehand.
Yes, I think COVID has taken place of influenza at this moment, but there are incidents where we can get co-infections with influenza and COVID, and there are people who are at higher risk, even if they just get influenza alone. And so we want to make sure that we protect everybody who we can protect with from influenza if they're vulnerable. So the highest groups or the subsets that are most vulnerable from influenza are children less than 5, any child who has any history of asthma, and adults over the age of 65. So by vaccinating everybody who can be vaccinated, just like we do for COVID, not only am I getting my flu vaccine for myself, I'm also getting it for my cousin who's got asthma. And so that's what we want to do as well. And if we encourage everybody to vaccinate against influenza, it circulates less in the community. Those vulnerable populations are less likely to get sick. So that's an important thing to remember, that when the time that influenza season is around us, usually from October to May, we make sure that we get ourselves vaccinated.
And how young can you still get one of these influenza vaccines?
So influenza vaccines are licensed from 6 months and above. One caveat is if it's the first time a baby ever gets an influenza vaccine, we usually do a 2-dose series, kind of to remind their immune system kind of like we've done with COVID now. So everybody's kind of familiar with that concept now, thanks to COVID. But yeah, so in the first time a baby gets the influenza vaccine, especially if they're younger than 8, they need to get 2 doses.
And these are available at?
These are available at Worldwide Pediatrics, and I'm sure everybody who's part of Topline MD has these in their office.
So when a child does stay home when they're sick, what should parents be giving them to help them with their symptoms?
So if part of their symptoms involve fever, and again, it depends on the age. If you have a baby that's less than 2-3 months of age, you should contact your pediatrician immediately if your baby has a fever, which is more than 100.4 degrees Fahrenheit. If your child is older than that and they're not in any distress, but they're not feeling great because they're a little bit achy, they do have a little bit of a low-grade temp or a regular temperature, you can use things like acetaminophen, which is Tylenol. And in the older kids older than 6 months of age, we can use ibuprofen, which is Motrin and Advil, to manage the fever. And again, we're doing this to make the child more comfortable, not necessarily to treat the virus. It's not going to make the virus go away any faster. A common fear that we see is that the parent will give acetaminophen or ibuprofen, the fever will drop a little bit, and then once the medication starts to wear off, the fever will spike back up, and the parent is fearful that the medication is no longer working. You're right, it's not working anymore because it's running out. The virus is still present in the body's still fighting it off, and that's why we have the fever. So you want to continue to, if your fever is now lasting longer than 72 hours, then I think it's definitely a good time to get checked out. Talk to your Topline MD pediatrician and making sure that we look at everything. At that moment, we may not do anything more, but tell you, hey, this is still just a cold, and that's what we're doing, but at least it's time to make sure that the baby gets checked out. I guess things that you want to make sure you're monitoring for your child when your child has a cold is, 1, make sure they're drinking enough fluids to stay hydrated. 2, that they're not in any respiratory distress. And 3, if the fevers are lasting beyond 72 hours, which is around 3 days, you need to be contacting your medical provider at that time, just so that at least they can get a look at the child and make sure that everything's still staying okay.
Thank you so much, Dr. Millon, for all of this valuable information.
Thank you, Rebecca. Thank you for having me.
We have more resources on toplinemd.com for parents to learn more. Plus, if you don't have a pediatrician for your child, all of the affiliated doctors' information can also be found on that page. Topline MD Alliance consists of a group of top-of-the-line medical physicians and care teams who are committed to an exceptional patient experience while helping them to coordinate their care.